Now, Malaysia is to start testing wastewater for traces of COVID-19 on planes arriving from China. Fears of contagion are growing as Beijing eases restrictions and rising infections are overwhelming hospitals there. Despite that, China has been reporting only one COVID-related death per day for the last 2 days. But other nations are skeptical. In a tweet, the World Health Organization Director General urged China to provide transparent data. Several other countries are introducing mandatory COVID-19 testing for travellers from China. That includes South Korea. Eunice Kim has more from Seoul.
This eating and shopping mecca of Myeongdong in Seoul in pre-pandemic times was bustling with visitors from China, so much so that they could order their food or select their cosmetics in their native tongue. And even as the area revives, we are not expecting that influx to return even for the Lunar New Year holiday. And that's because COVID-19 contagion concerns will be keeping them from visas.
Will restrict issuing short-term visas in China. It is necessary to refrain travel from China until the virus situation is stabilized.
In new guidelines released by the Health Ministry, non-essential travel will be restricted from January 5th throughout the month, if not throughout February. There won't be additional flights added, and all existing routes will be funneled through a single airport, Incheon International. For those who qualify to enter, they'll need a negative COVID-19 test result to board and take a PCR test within 24 hours of arrival. South Korea has been trying to maintain its own COVID-19 infection situation under control. This comes as senior citizens' boosted rates remain stubbornly low, and as the number of COVID-19 related deaths and serious cases have been on the rise by double-digit percentage points this past week. The winter months ahead still look challenging for health officials here.
Now, in contrast, Indonesia has announced it will now lift all COVID-19 restrictions. President Joko Widodo says the spread of the virus is under control, with infections and hospital admissions below the World Health Organization's guidelines. He called on people to remain vigilant, however, saying they should keep wearing masks in crowded areas. Well, let's now speak to Dr. Bharat Pankania, who's a public health physician and specialist in infectious disease control at the University of Exeter Medical School, and he's joining us from Bath in the UK. Thank you so much, Dr. Pankania, for being with us on Al Jazeera. So there is growing concern about the number of cases of COVID-19 in China. Is there any data that indicates what kind of variant is dominating and causing the rise in infections there?
So our understanding with respect to China is that it does not have an unusual, different variant to what is circulating in other parts of the world. Having said that, because there is that issue of trust and transparency with China, we can never be 100% sure. But my empirical feeling as a clinician, in somebody working with this issue, is what is circulating in China at the moment is also circulating in other parts of the world.
What is at play here, you think? Are we back at the end of 2019 or early 2020s when China was the epicenter of the pandemic?
So this is a clear case of how China tragically, very tragically, has mismanaged the second half of its pandemic. It did really well with its test, trace, contain when we had no vaccines. Unfortunately, after the vaccines arrived, China did not deploy the better quality, the better performing vaccines, the mRNA vaccines that the West used, and China pursued an absolute zero policy. So now we have a Chinese population that is not immune, has not encountered this virus before. So when they open up, and they open up suddenly, all these people are as if they've never come across this virus before. Some of them, the vulnerable, elderly, old people, will get very ill. They will clog up the hospitals. And unfortunately, a small percentage of that elderly, vulnerable population will die as well.
Right. Dr. Pankania, how much should the rest of the world be worried then? And perhaps how much further ahead are they in terms of the resistance and vaccination rates compared to China?
That's a great question. So the Western world, which is not only immunized but serially boosted, is in a very good place. Countries that are not highly immunized or boosted, for example, India, would be very concerned. So if I were an Indian politician, I would be saying, my country is not heavily boosted. A surge of infections may be coming from China. I had better immunize my population to protect them, because we can't keep this away by locking our borders. The one thing that we know works is vaccines, and use good quality vaccines to protect your population. With respect to variants arising, well, of course, it can arise from China, but it could also arise from anywhere else in the world too. And for that, we keep on observing, monitoring, and checking. But to protect the population, use the mRNA vaccines, immunize.
Dr. Bharat Pankhania, always good to talk to you. Thank you so much for joining us on Al Jazeera.
Thank you.